I'm not, almost 91 years of age. You don't want to hear my history. My goodness. No.
It's all interesting, believe me.
Well, I'll give you one hint, though. The story that we're going to look at today is one of used to be a major etiology in producing children with intellectual disabilities. And 1951, I was over fighting the North Koreans and the Chinese in Korea. A fellow named Osborne Folling, who happened to be a Norwegian pediatrician, had some relative came in with a couple of children and said, "What's wrong with my kids?" And the doctor sniffed at him, and then he got a urine and blood sample. And Osborne Folling was the first one in the world ever to identify this particular syndrome we're going to talk about tonight as something special. And he tested the blood, of course, in the urine, and discovered that the urine was phenylpyruvic acid, which he quickly was able to determine was caused by an excess of phenylalanine in the child's blood. Wow, just like that. And so he named it phenylpyruvic oligophrenia. What the heck is oligophrenia? Any Latin scholars in the group here? Not a one. Why is that? I'm not one either. Oligophrenia just means little brains. So what he was doing was naming this newly identified etiology in mental retardation. At one time, it was fairly large, nothing compared to, say, lead intake that children were getting off of paint and stuff like that. That was causing much more mental retardation than this ever did. But again, we solved both problems eventually. And that's a wonderful picture of facts, and I can't read it from here.
So all I did is Bob, I have the guy's name that you just talked about. He's up there.
Oh,
so I just
Osborne.
I put his name up there.
Okay. I should make copies of this so I can look at it. Anyway, the name you see up there is one Robert Guthrie. And I have to tell you that for me, this was a fantastic experience. I came back, of course, from Korea in one piece and eventually went on and here at the University of Illinois. When did I get here anyway? Anyway, sometime after I got out of Korea, so it must have been late, 50s. And at about the same time, this thing was beginning to develop. Once identified by the German, Osborne Folling, in Norway, why then the word spread around and they went out and tested for it and became quite well known. One of the principal people is one Robert Guthrie, the PKU story. And why he's on the label as the PKU story is that it was just too difficult to identify these kids. When I first started, I was with the California State Department of Education, and a young pediatrician in Los Angeles, Richard Koch, said, "You ought to come down and work with us on this, because if we could find these kids early, we think a diet might work to prevent mental retardation." Wow, prevention, that as a school marm, that's great. If I can prevent kids from going into special ed, that's even better than teaching them after they get in there. So this fellow, Robert Guthrie, he's in Buffalo, New York. And he had an aunt, I think it was, bring her children in for him to look at. And he smelled this strange smell and came up with this idea that, well, this might be PKU. And sure enough, it was. first urine testing, and then blood testing to verify that it really was PKU. And so Guthrie, once he got interested in this, said, well, the testing is all wrong, though. You find the kid already retarded, and then you test. What if we tested him near birth and could prevent this by taking the phenylalanine out of the diet and giving a child they call it Phe, P-H-E, for phenylalanine, it's too much to say. We take the Phe out of the diet, mix it up with all the rest of the food, put it back together again in a form of milk-like substance that mothers can feed to their children through bottles. And simple solution, but how the heck do we detect this at birth? Most of the detection came 6 months later, after the kid's already retarded. Oh, well, then I can smell this funny smell. Okay, why can't we identify this excess of phenylalanine earlier? And so Bob Guthrie set about developing blood tests that I think he was the first in the whole world to do it. A drop of blood on a large, not a large, a heavy-duty filter paper. That's it. And once he had that, then he could put it into an assay disinhibition procedure. Don't ask me. I'm not a lab technician. I wouldn't know how to do it at all. But there's some kind of liquid that you put over the drops of blood, and if there's phenylalanine in it and this special solution, it will eat through the inhibition material and show little spots, and those are the PKUs. So he developed this test, and now they go a little further than that. That 1 or 2 drops of blood that they take out of babies' heels during that first 3 days of life now test for 50 different metabolic errors of metabolism. So this original test that he developed is now expanded, and as far as I know, it's mandatory in all of the states of the United States. But when I got interested in this, shortly after getting back from Korea in 1952, 53, there was very little interest in it in a general sense. But once these tests became available, then the interest went up very high quickly. Phenylketonuria is a heck of a word to come up with. It's better than phenylpyruvic oligophrenia, but it's still too big. So we call it PKU for short, much simpler. Next. Okay, 90%. Oh, yeah. When I started working with them, the only ones we could find would be in institutions, locked up almost all of them. Very few stayed at home because of this fact that 90% of them suffered enormous brain damage from this excess of phenylalanine. So it was important to, A, develop this early test that Bob Guthrie did, and then B, to insist that every hospital, every place a baby was born, that the test was administered somewhere early in life. Well, there were doctors that that's the wrong way to go at it. Wait till they're 6 months old. 6 months old, they're already retarded. So Koch and some of the others got together and created with 19 different medical schools in the United States that agreed to participate. And they gathered data and sent it all into Children's Hospital of Los Angeles, where Dick Koch was. And then we'd analyze what came in from that. Some of the doctors in the group said, well, why do all this work? It's too much trouble. we finally convinced them that it was a good idea, because by this time the pharmaceutical company had come up with low-free diet, the fee being the phenolphthalein. And so we now had, if we could identify these kids early in life and could get the mothers to work with a diet and with dietitians and stuff as the children grew older to change the diet to include less phenylalanine, by golly, we might be able to prevent mental retardation from occurring. It was an interesting study. It went on for 20 years. What's the next one? Oh, well, we can go through associated findings if you want to, but that's not too important.
You want me to keep going or back?
Yeah, no, go forward. One of the problems we discovered, I discovered rather, no, we'll go back to the picture. Yeah, there we are. I was told that, well, one of the things that happens when you have a child who has this problem, they become very fair-skinned and everything, and fair. You want to pick out which one of those kids is PKU? I couldn't. It was a Mexican-American family. It came into the Children's Hospital. And I'm trying to think now which one it was. I think it's a little boy. Second one from the left there.
Not the very little one, the second to the little one?
Not the little one, the next one up, in the white shirt there. Yeah. So I learned quickly that you can't depend upon these secondary indicators. You have to use blood tests to absolutely verify whether it is or not. Now, how in the heck do people get this thing anyway? Well, 1 out of every 17 persons in the United States, theoretically, I don't know what it actually is now, but that's the numbers we were given then. 1 in 17 of all of us have I'll call it defective gene. And what we mean by that is you do not have the gene does not have the power to produce the enzyme to take care of this excess phenylalanine or any phenylalanine. So what happened? How does this happen? Well, this is a picture of the possibilities. The mother and father are the two on the top. And you notice each one of them has a capital, meaning the gene will produce the enzyme. And each one has a small p, which means missing that enzyme. Notice what happens now. If child number 1 over on this side with both capital P's is perfectly normal and cannot even transmit this condition. The 2 in the middle are exactly like the parents. That is, they have one dominant gene, in other words, that will produce the enzyme to convert the phenylalanine, and the other one doesn't. But the one is all you need to be perfectly normal. The poor fellow on the right here, though, catches both of this gene that fails to produce it. And so for that child, he has no enzyme to produce it, and therefore the phenylalanine continues to grow. And we think that, I'm trying to think. Oh, in this 20-year study we did of this, they finally came down to the precision of 17 days after birth. If you can catch the child in 17 before that time occurs and put him on the diet, there should be no mental retardation, no brain effect whatsoever. If it goes on to 2 months, 3 months, 4 months, each day the effects will be greater and greater. So that's why it's very important that this kind of screening go on very early. But when we started this screening, we made a mistake. And I say we. The 19 clinic directors that got together to try to figure this out. Well, I don't know. Up in our hospital, we send the mothers home after about 2 days with their babies. Uh-oh. We were pretty sure that some kids we wouldn't pick up. But that's what they wanted to start with, and so we did. And it was, oh, I forget how long we started getting sufficient data that, what's going on here? When you screen kids at this 3 days of life or so, you get twice as many boys as girls. There's no XY chromosome involved in this. That's impossible. And so what we found out, of course, after special testing, girls are able to they're able to absorb, apparently, this phenylalanine much better than boys. So the boy, if you catch him in 3-4 days of life, you'll get a real positive 5 milligram percent or more of phenylalanine, which is abnormal. 1 to 3 is normal. With girls, we were testing them, and they're all right, let them go. But when we retested them at 10 days of life, we picked up enough girls so that it showed that it had nothing to do with the sexual. It's just that girls don't need to be so concerned about it because at that age, because they're able to somehow take care of this excess of phenol.
So there was really a gender difference.
Yeah, a very severe one, because what we had to do was completely reorganize our protocol, and we insisted that every baby that was born, female baby, was not to be tested until 10 days of life. Well, they're not in the hospital anymore. Well, it doesn't matter where they are. You find them and you test them. Because, again, there's this probability that there'll be one of these children that needs a special diet. So that was at least pretty effective. How does it work? I don't know if anybody can see this anyway. Metabolism is coming down on what is it, my right side? Yeah, it's good side. It's normal. And then if you get over there and you lack this enzyme, though, then these problems start arising, and we call it PKU.
You want to go back to the characteristics? You had a slide with characteristics. Do you want to go back to that one?
I don't think so. The associated findings, if you miss the kid and he grows up of any age, 6 months or more, you'll find all of these different findings occurring that this phenylalanine, when it comes through the blood to the brain of the small child, an infant, is particularly disastrous, I guess is the word, because it actually will destroy brain tissues. Why? Because the myelinization of that gray stuff we call brain matter or brain cells has not occurred yet. And so when babies, they're very vulnerable to any kind of a condition like this. Moving right along.
Then we had the picture.
Oh, well, I've shown you my inability to use the so-called frequently discovered that they're much, what do you call it, fair-skinned and fair-headed. And, of course, the hair of the boy in white there is just as black as their parents, and you can't tell anyway at all by looking at him that he has PKU.
You maybe mentioned this, but I don't remember the sniff test, that there was like a sniff test in the beginning because there is a certain odor.
Oh, yeah. That's actually how Guthrie, I think, found his kids right off the bat. He smelled, what's going on here? He smells the kid, and sure enough, up through the hair, and then particularly in the urine, is this phenylpyruvic acid, which is a very nasty smell. While I was working on this big, long 20-year project, we brought lots of families in to take who think they might have some problems like this. And so when I would come in to work on the project and look at the data from all these other incidents, I'd see mothers with their children there, every time I'd go over and say, "Oh, what a pretty boy you have, or a pretty girl," and I'd sniff them. And sure enough, I have the right kind of sniffer that could pick them out every time. I told the nurse, "This is one," and she'd go do the blood test. Sure enough, PKU. So some people have got those kinds of sniffers, and I happen to be one of them. I don't know how many, how often it is, but it worked. Oh, we're up to questions. Good. How did we do that? You want to hear more about the study? It started off, as I say, with 19 clinics, and we had all this different opinions among the pediatricians. I think you could use a secondary symptom. We'll look for kids that look less stuff in their skin and hair and stuff. That wouldn't work. We discovered that was no good. Then some of the doctors were convinced that, well, all right, we'll start the study and we'll keep going for a few years. But once the myelinization of the brain, not cells, but what is it, neurons and whatever in the brain, once that myelinization occurs, we won't have to worry about it anymore. We can take them off the diet, right? Wrong. We really looked carefully at these kids, and there was an experiment where we took random numbers of the children, notified the doctors that, okay, this one take off the diet, this one leave on the diet, but don't tell anybody. And then we did the doctors again did blood tests and so forth, and we had psychologists doing testing, of course, all the time for intelligence testing. And sure enough, the two separated immediately. The ones that stayed on the diet continued normal growth and development. Those that went off the diet immediately started losing some of the skills, competencies that they do. Now, these little tiny kids, you don't have to be a PhD psychologist to see, wait a minute, this kid, a month ago I saw him, he could do this, now he can't do it anymore. And that was the one that's been taken off the diet. So the study quickly went back onto the diet. And one of the major results of this whole thing is that it was a nationally financed study, obviously, the National Institutes of Health. And finally, when we came up with the answers about early diagnosis and the type of treatment, and you got to maintain the treatment, then the federal government issued something out of, what is that place in Atlanta, Georgia? National Center for something or other, anyway. Yeah, and so...
disease place, is that what you're talking about?
I guess.
Yeah.
That
Say
sounds
it
right.
really loud.
Center for Disease Control.
Center for Disease Control?
I think maybe that is it, yeah. Which, I don't know if this is a disease, it's a condition, but anyway, this federal agency sent the word out to all the states right away to get this information clearly there and to separate out the no, I don't think it's necessary doctors, that we proved that it was necessary. And so the information went out to them, and all 50 states now mandate an early test, not so early for the girls, but more for the boys. And so the thing is nationwide. And now, thanks to this one fellow, once he got this test going, and we were pretty sure that the results were going to be very positive from the standpoint of early diagnosis and then early intervention, he started going around the world. And so in fact, every single developed country now does this early screening and dietary control. And a number of the developing countries as well. I don't know how well it's done in the poorer countries that don't have good medical care of any kind, then they're probably still producing children that are going to become retarded because they just either they don't have the money that it takes to use these kinds of tests. The Guthrie test, by the way, I explained, was very simple. It's filter paper, and then you take the substance and put on it, and sit it there for a while, and you look at it, and that's PKU, and that's PK. It's that simple. Even I could do it. And Bob Guthrie took backs of this stuff and went around the world at his own expense to let people know how to do this and to. And as I say, now I think all developed countries have it, and most of the developing countries that are coming along.
So, Bob, you told me one time that as the child gets older, maybe even close to adulthood, then can they be off the diet?
This is a real good question because when I did this study, this talk last time, did you hear what happened to me after I walked out the door?
They didn't, but I did.
Yeah. I finished my talk and everybody's happy, and I get up and leave. And I don't get out the door, though, to my car until one of the students who was here comes out and says, "I'm PKU." Wow. So it must be working. In other words, we caught him early. We got it so that as a young adult, he had no mental retardation at all. Good Lord, you don't get into this place, unless you can pass some kind of test, right? So he obviously was a prime example of how good the system worked. One of the things that happened, by the way, that along the way, excuse me, was that some of the doctors that we had in this study said, well, that's all right. The diet's fine for up till 8, 10 years of age.
You like a drink?
Third. Raw throat now. But there were these doctors that insisted that, well, once the child gets so old, you can take them off the diet. And this young man that came out of your class last time was one of the examples that our recommendation to the nation when we finished this study was do not take the child off. Keep him on at least a modified diet. It doesn't have to be as strict as when he was small, growing up, but still. And when I had a chance to talk with this young man, he said, I asked him, are you on the diet? Oh, yeah. Earlier, I went off the diet, and I found I couldn't remember things, and I couldn't understand things as well. Went back on the diet, and right away, he's back to full use of his brain. Excuse me. So it's important that the diet, although it has to be modified, of course, from a baby on a bottle of this medicine to an adult, you got to go through dietary changes. And that's where this 20-year study was so valuable. It wasn't just MDs, pediatricians, or people who did laboratory testing. It also included nutritionists and dietitians who could work with the parents from the baby to the next stage of food, soft foods you take. I don't know. I haven't had any babies around me for a long time. I don't want to feed them anymore. But as the child grows older, obviously the diet's got to change to increase the growing needs of the child, physically growing. And that's where the dietitian nutritionists have come in very handy. For years and years, there was a PKU national news that a nutritionist out in Oregon produced that took these recipes for making cookies and everything else out of material that would not have high phenylalanine in it, and yet would still be good to taste. In fact, every time we met on this 20-year-long study, the dietitian, nutritionist would come in and say, "Oh, now you want to try out this cookie, please, and tell me what's." That doesn't taste very good. How about this one? Oh, yeah, that tastes good. So we got to taste all these things ahead of time, even though none of us in the group were PKU that I know of anyway.
Questions?
Yes, ma'am.
How many births, how many children are affected?
What was we came up with about 1 in 17 of all of us have this bad gene. So what's the chance of 1 in 17 and 1 in 17 marrying? You multiply 17 by 17, and that's it.
I'm sure
But
there's a better mathematician out there than me.
Okay, but then that's one person. But no, if we multiply them together, then that's the chance 1 in whatever the number is, chance of mating with somebody with the same bad gene. But then, if you have children, as we saw, one of them's not going to have it anyway. It's going to be perfectly normal, have the both of the good gene. 2 of them will be carriers like the parents, and only 1 child out of the 4, on the average now. Statistical average is something else. We've had families in the study that had 4 children, 3 of whom were PKU. It's just the opposite of what you'd expect from it. But that's the trouble with statistics. Sometimes they don't apply to real human beings.
So we don't have an exact number for you. It's pretty small. Pretty small
It's pretty small.
But it's a definite cause of intellectual disabilities that was pretty much eliminated with this test, if the person is on a diet and they get the test. That kind of thing.
Yeah.
Yes?
It's 1 in 10,000 to 15,000.
Say it real loud.
1 in 10,000.
1 in 10,000. She says
Wow.
it's 1 in 10,000.
Sounds about right. I've never gone out to try to count them, so I'll accept your figure.
So having autism is much more common, because I think that's 1 in 66. 1 in 66. So, yeah.
Yes, sir.
Did you come across any situations where a child had the PKU trait but didn't exhibit any of the characteristics?
So a situation where a child had the PKU
Yeah.
but didn't exhibit the traits. Was there ever a case like that?
Oh, not to my knowledge. And, this national study covered every single institution, public and private, for children with any kind of disabilities, intellectual disabilities. And so we could, check before the study started, the PKU kids in it, and then after the study started and we were correcting this, there were 0. And so as far as we get. Yes, ma'am.
So I don't know what phenylalanine is. What's the diet like?
What's the diet like?
Fortunately, my experience with it was eating cookies. But they were perfectly good as far as I was concerned. It's a matter of teaching the parent who's not for infants, of course. That's pretty simple. It's take milk, break it down, take the phenylalanine out, throw a bunch of minerals and stuff in it, and put it together again. It looks like milk.
A formula of some kind.
Yeah.
Formula. Some
Yeah,
kind
the
of
formula, right. But for older kids, it's much more difficult because, they don't stay on the bottle for all the time. And so you have to have a dietitian, nutritionist, kind of a team that will, that I shouldn't say will, that did look carefully at the growth of children, how the diet has to change, and all kinds of recipes came out of this study for parents to use with kids as they went up through the age.
But they won't be drinking Diet Coke, because there's a message on Diet Coke. I'll pass it around if anybody wants to see it. See if you can't find the message.
What's the matter with it?
Diet sodas, there's a message right on it, attention.
Oh,
Phyloneuritic contains phenylalanine.
So all diet sodas probably include that ingredient that those individuals that have PKU should not have.
and this is aspartame?
Well, it could be, I don't know. I just know that there's a message that's a warning on there for anybody with PKU. So.
Uh-huh. Well, then I can tell you exactly what it is. It's got to be aspartame. Aspartame is 100 times sweeter than sugar. And guess why they use it in things like that? It's a lot cheaper, obviously. So I don't know how many other substances they've tried to switch. Saccharin, I don't think works. But if you are PKU, you look very closely to be sure that things like saccharin, what did I just say?
Aspartame?
Aspartame, which is this one that became so popular because it's just 100 times as sweet as sugar and very cheap, therefore, to use in things like this. But once you know what's in it, then you can find all kinds of things that are not and use that.
Go ahead.
For the children who already developed intellectual disabilities who had PKU, were any of them put on the diet to see if that would help them?
So anybody who already had intellectual disabilities from it, changing their diet, does that help?
Yes, indeed. This was one of the early discoveries. The doctors, we want to test them and get them before they have any problem. And the one I know best, not Guthrie, because he was in where was he? Buffalo. The one I worked with is Dr. Richard Koch, K-O-C-H. In fact, this book is written by Jean Koch, who is Dick Koch's wife, and of course was part of the work of trying to find out what's going on with these kids. And what am I trying to do? I'm coming up to now these are older kids now.
And so if they already have intellectual disabilities, will
Right.
changing of the diet help?
And this Dr. Koch that I worked with, whose wife wrote this book, got interested enough in it, and when kids would come late, that is, didn't catch them at birth, and so they're now 6 months, 8 months and things. And Koch said, well, we'd like to have it started in the first 17 days of life, but what the heck? Kids need, maybe this will help. And so he started using the diet with all of his patients, no matter how far along it had been before they caught the fact that he was PKU. And in some way, there was a lot of deterioration still going on. The child wasn't growing, normally at all. And we put on the diet late. It seemed to have that effect. Then last time in this class, the young man that met me outside, I asked him, well, are you still on the diet? He said, oh, yes, because he, I think, was in high school. And, I got this funny diet. I don't want to have that. You know how high school kids are. They don't want to be different like that. So he went off the diet. Oh, boy. Within a couple of weeks, I can't do this algebra problem anymore. I can't remember the things for chemistry class. And he put himself voluntarily back on the diet, right back up again with good control.
But folks, there was some improvement, even though it didn't wipe away the intellectual disability. It did have impacts
Oh, yeah.
on their development in other
Right.
ways.
Yeah. And this young man, of course, that I met from your class last time, happily, he never went off the diet that much. But he did say something about trying it in high school because, I don't want to be like nobody in the school except me takes this funny diet. Well, he convinced himself after about a week off the diet that, boy, I need this or I can't function effectively.
So was there ever any research done to see how long and then it was permanent?
No, as far as I know, it had. We spent 20 years in this one study, and the kids grew up, and when they reached, the end of our study, as far as we could tell, they were still on the diet and still working, but our funds stopped, so the research study stopped. So I can't answer the question.
But that would be an interesting thing, is to see how much intellectual disability could be reversed in some way, depending on if you get them at 2 months old, 4 months old, 6 months old.
We prefer to do it in the first 17 days of life. But
Other questions?
Can you describe the characteristics of PKU, like in more depth?
So she'd like to know more about the characteristics of somebody with PKU.
Well, with PKU you mean a child that I've caught in the first 17 days and is on a diet, perfectly normal, absolutely nothing, no difference whatsoever, and this frequently associated findings are kids that were locked up in institutions. And
From a long time ago, these are the facts from a long
and
time
so they
ago.
had all kinds of brain injury. It affects the emotional part of the brain, particularly the frontal lobes. And so kids that need this diet it's very important to get on it as fast as possible and stay on it.
When you think about it destroying the brain, and I think it's funny, majority have disagreeable and schizoid-like personalities. I think there's only been one person that I knew for a fact that I've worked with in the past that somebody announced to me that person had PKU, and it was an older woman, probably in her 60s.
Oh, but done.
And she had a lot of challenges. Her behaviors were very challenging. She had a lot of self-injury. She had a lot of aggression. She was a very difficult person. But again, when you think about that, every year, there was more and more damage. And I don't know if she was on any kind of a special diet. She had been institutionalized.
Yeah, that's terrible because one of the first patients I ever saw with this condition was at the Spadra Institution for the Mentally Disabled in California. And, that's a great big institution. And I saw this woman who was just, man, boy, talk about, she had to actually be physically sit down because she'd actually bite herself and start chewing on herself. It was just an enormous something attacking her brain. And fortunately, the pediatrician, not pediatrician, anyway, one of the MDs that I came out to he came out to the CEC convention in Los Angeles in 1950, I think. I took him down to this spotter and we looked down and he said, that's PKU, I'll bet you. And if you put her on the diet, get rid of so much phenylalanine in their system, all these symptoms will disappear. And this woman was physically strapped down. It's the only way they could handle her without hurting herself. 2 weeks later, I went back to see, where is she? She's not there. Oh, she's with the other patients right there. And all of this wild kind of behavior ceased almost immediately.
So there could be some improvement. That
Oh,
to
yeah,
your question.
yeah. I'd recommend it. I don't care what age you are. If you have PKU, get on this diet and you'll be better.
Can a baby be tested before they're born?
No. I say that. I've never tried it.
There wouldn't be a need because the baby isn't consuming anything at that time, so there's no danger in the developing fetus.
Oh, no, no. It's after the baby is born and starts either ingesting mother's milk or formula, both of which contain, of course, the phenylalanine.
Sorry.
What did I do wrong? Anyway, nothing would show up at all. In fact, when you, as I said, if you're testing for it after they're born, it doesn't start to build up in the system, in the baby system, until, well, we were talking about 17 days of life, but with boys, you can find them much earlier. They're usually 3, 4, 5 days of life. They start showing sufficient amounts of excess phenylalanine, either by blood tests or urine tests. And the girls, you got to wait though till about 10 days of life.
So Bob, last time you told about the story of mothers who maybe were off their diet when they were pregnant.
That's study number 2. We no sooner got through with this 20-year study on phenylketonuria, solved all the problems, had everybody agreed, and somebody said, well, what happens though to these females, treated PKU females, when they reach childbearing? Golly, I don't know. Well, we got to find out. So we went back in all these 19 institutions in the United States and told them, go find the females, find if they're married or pregnant or both, and let us know what's happening. And sure enough, the first ones found the babies had suffered both physical and mental retardation. In other words, while they were in the fetus, the mother's excess, but because by the time they were adults, why they were off the diet and surviving very well. Not as well as they could have done on the diet, I think, but anyway. But then what happened was when we were able to get enough of the female treated PKUs to go back on the diet, we tried to get them to do it 3 months before they were pregnant. That was difficult. Many of them weren't sure they were going to even have babies this early. And so we caught them 1 month, 2 months, 3 months pregnant. But even that worked. In other words, the babies did not suffer from brain damage to it.
So it didn't mean that the babies had PKU, but the fact that the mother had PKU and her body was toxic and there was a developing fetus within her body, that's what was causing the disabilities.
Yeah, that was it.
Another question. Go ahead.
So that's only if she wasn't on the diet, right?
If that's only if it wasn't all controlled, then there was a potential for the toxicity, her to be toxic to the baby. So if she was on the diet, it was good.
Oh, yes, yeah. We've had no problems. I forget how many the 19 clinics came up with initially. And, of course, each of the mothers were advised, or mothers-to-be were advised of the problems that could occur if they didn't go back on the diet. I think we got 100% acceptance. And the diet, of course, for adults is not a bottle of milk or anything. It has to go through. And this is one of the reasons why all of these studies didn't have a pediatrician who knew everything. A public health nurse had to be there, a dietitian, nutritionist. In other words, we had a whole team that would work first on the diagnostic process and then work with the parents to ensure that the dietary problems are fully understood. And then when we got to study number 2 with the females of childbearing age, then we went through the whole thing again to come up with because the adults. What I don't have to worry about phenylalanine. The heck you don't. If you're going to get pregnant, you better be very careful, or you're going to have a horribly deformed child.
How long were you in that study?
The second one, that took 20 years too.
So what I think is really amazing is, for Bob, 20 years is, like a fraction of his life. And for a lot of these kids, it's their whole life.
I'm only 91 now, but I spent 40 years on that tooth progress.
Yeah, so he's
Yeah.
kind of an expert in it. You had a question. Having PKU, is it painful?
To the child, it's not the same thing that, this hurts or something. The baby, if you don't catch them and they start to develop normally, and then this darn excess of phenylalanine starts taking away their skills to move properly, to walk and so forth. In that sense, they're aware of it. But they don't come forth and say, I think I've got PKU. No. And a lot of doctors don't recognize it either without a blood test. They
So
think
there
it's
isn't
something.
like a particular pain, like in your leg or something like that.
No, it's strictly intellectual, and
So just loss of function, thinking, and then it can go to the rest of your body because your brain is the center, right? And so when there's damage to the brain, it can affect almost any part of your body.
right.
One last question. Anybody? Burning question, yes.
So I know that phenylalanine is a type of amino acid. So what foods like explicitly would be just like absolutely avoid?
So do you know maybe 5 foods that they should never eat?
Oh, heck no. Except pure phenylalanine, of course. I mean, it's like,
We'll have to Google it, all of us.
what's the one that we had here in the bottle?
The Diet Coke.
Yeah, had aspartame. Now that's just a synthetic thing that is 100 times more sweet than sugar, so it's spread through a lot of things. You have to be very careful not to eat anything with aspartame in it. But
So a lot of prepackaged foods, now you are going to go look and see what you're eating, right? And look at the ingredients, and you often will see that as a warning.
Yogurt has a lot.
Yogurt, because of if we have the low fat or low calorie or low sugar kinds of things, yeah, because they're going to put something else in there.
one good thing that happened was that Dick Koch and Guthrie and the others, when the study was going along, they said, well, the important thing is we've got to, not just for the babies, but as the people grow older, they've got to get information about this. And so by law now, it's required that certain high phenylalanine things are identified in the food you take. And that, of course, is very valuable. But for PK kids growing up, they need a team of dietitians, nutritionists, public health nurse, whoever, that can come out and help them with this, to get this diet and then change the diet as the child grows in size and eats all kinds of different things. And the best people to do this, of course, are part of a team that really know PKU.
But there isn't a medicine. It's a diet.
Oh,
right?
yeah.
I mean,
Strictly
you're not
diet.
like giving somebody an injection or anything like that. So it's totally based on what you consume in your body. So that's kind of interesting.
And for people without PKU,
Okay, so
it's
for
totally fine.
yeah, for those of us that don't have it, and we can consume that
Sure.
ingredient without a problem because our body will get rid of it.
Oh, sure, yeah. But back to that first one with the things coming down, if you've got the double whammy there, and you don't have the enzyme normally from genetic what are they? Chromosomes, I guess. But most of us don't have that problem, and you better not have it by now. But as a kid with PKU gets older and older, the diet has to change, of course, to fit his increasing physical as well as mental needs. And this is where this team of dietitian, nutritionists can help. It's not a big deal, by the way, anymore. At one time, it was, now what do I do? So you went to one of these people and got some direct information on what they could do to change the diet for the child. Today, PKU diets are stacked high on tables, and primarily because of the teams that we organized in these early studies, we realized it was going to have to change as they went along. And so they not only changed it, but they developed the diets, recipes that would effectively give the child the nutrition they needed as they grew into adulthood.
So we've got, and Chris, you're all familiar with the gluten-free diets and the lactose-free, and so I think there's just a lot more diets out there that kind of fit people. So,
and of course, as you mentioned, as soon as the females, treated female PKUs, came into a childbearing age, they had to go back on the diet, or else this condition which their brain now can handle, of higher levels of phenylalanine without any damage, is going to damage the fetus, though.